Hello, if you are a junior doctor and looking for a clear and practical way to approach an ECG to see if there is any heart blocks going on, then this is for you. I'm Dr. Mustafa and I focus on practical and clinically relevant teaching, and today we are going to discuss about the heart blocks. So as the name indicates, it's some kind of blockage. So it's a problem with the conduction and not the rhythm, and it is usually at the level of AV node, or it can be even below AV node, that is at the level of bundle branches or the bundle of hairs. So if we can look at this diagram, in the blue one we have the SA node, which is the main pacemaker of the heart, and then we have the red AV node, which basically regulate the rhythm, and then from there the current passes to the bundle of hairs, and then the yellow and green ones are the further branches. We have right and left bundle branches and Purkinje fibers. So we can say that we have SA node that will lead to contraction of atria, and then through the internodal pathway it will lead to AV node, and then AV node will eventually contract the ventricles. So let's look at this ECG. We have P, Q, R, S, and the T waves. So while looking at the ECG, if we can just look at the P wave, it basically represents the atrial depolarization. By that, it means the atria are contracting. And then the PR interval, which means the AV node conduction. We can also say that this is the time for the ventricles to relax and fill up. And once that phase is done, then we move to the next part, which is contraction of the ventricles, which means the QRS, and that basically represent ventricular depolarization. So that's basically the conduction path. And other than that, in the ECG, we will look at the PR interval, which will be prolonged in case of heart blocks. And by prolonged, I mean it would be more than 0.2 second, or we can say 200 millisecond, or we can say 5 small box or 1 big box. Everything means the same thing. And the next thing is the heart rate. It would be on the lower side. It could be 60 and below, but mostly we classify it in bradycardias. So we can say the heart rate is 50 and below. Let's look at this ECG now. This is a typical example for first degree AV block, or we can say first degree heart block. And in this, if we can see in the ECG, the PR interval is prolonged, and we can say that it is constantly prolonged, that is fixed and prolonged. So, and apart from that, the QRS complex is there, the D waves are there, everything is there. So we can say that the everything is conducted, but it's kind of slow as the PR interval is prolonged. So it's a bit lazier or slower than the usual rhythm, and it is mostly asymptomatic, and it can be seen in case of side effects of some drugs as mentioned, beta blockers, calcium channel blockers, naproxen, and electrolyte imbalance as well. So let's move to the next ECG. So here, looking at this ECG, we can see something is being dropped here, but let's look at it. This is an example for second degree AV block, and in the second degree we have two types. We have type 1 and type 2. So here we are discussing the type 1, also known as Wenkeback. So in this, the PR interval is long, and then it becomes more longer, and then there is sudden drop of QRS complex, like there is no QRS complex. So we can say that the PR interval is longer, and then it keeps on getting longer, and then there is a drop in QRS complex. And the defect in this case is also at the AV node, just like the type, and just like the first degree heart block. So this condition is usually benign, but we always correlate with the patient's clinical presentation. And this kind of situation can be seen in inferior wall MI, in which there is a defect in the right coronary artery, which supplies the AV node. So that can explain like why there is an issue with the AV node in inferior wall MI. So that's it about the type 1. Let's move on to the next ECG. So this is also a second degree heart block, and here we will talk about the type 2. And if we look at the ECG, we can see that the PR is prolonged and it is fixed prolonged, which means that it is, of course, longer than the normal, but it is fixed, prolonged, and then there is a sudden drop in QRS complex, which makes it really serious. And in the second degree AV block or type 2, the problem is usually below the level of AV node. It could be at the level of bundle of his, the branches. So it is basically below that, below AV node, I mean. And we usually see it in anterior wall MI. And it is quite dangerous because it can lead to a complete heart block, which is also known as the third degree heart block. So it is almost in most of the cases, it will eventually need a pacemaker. And another important clinical point is that the atropine will have no effect in this kind of patient. So we will not see any improvement because atropine is only useful if the problem is up to the level of AV node. So if it is not that, then it will have no effects. So if in clinical setting you give patient an atropine and there is no improvement, it can indicate that the problem might be at the level other than the AV node. So let's move on to this. This is an example for the third degree heart block. And if we can just look at the ECG for a longer duration, we can appreciate that the PR interval is definitely prolonged, but there is no correlation. It's kind of a divorce that has happened here. As we can see in the first one, like it's a bit long, and then there's longer, and then it is a bit different than the previous one. So in this case, basically the atria and the ventricles are beating independently, which basically means the P wave and the QRS complex, they have no relation. So this is quite serious condition and it always need a pacemaker. And this is a situation in which the patient can present in kind of a shock and he might be having a severe bradycardia. So it's kind of an emergency and need urgent attendance and cardiac care. So that was the main and the basic things about all types of heart blocks. And if there is anything confusing or any other question, just let me know. I will try to answer that. Thank you for watching.